So now let's look at how do you diagnose a patient with infection. So as you recall, the surface antigen is associated with infection. So of course you'd expect the surface antigen to be positive. Now the surface antibody is associated with immunity. So if somebody has an infection, you would expect the surface antibody to be negative, otherwise they'd be immune. Now, as you also remember, the total core antibody is also going to be positive because that's always present. So once you've diagnosed a patient with infection, which is primarily that the surface antigen is positive and the surface antibody is negative, the next question you need to answer, well, is this an acute infection or a chronic infection? So there are specific serum markers which help with that. So as you remember, IgM core antibody is associated with acute. So it'll be positive with patients who have an acute infection, and you will be negative with patients who have a chronic infection. And keep in mind, this is also positive in the window period, which is also an acute period. Now, for the chronic patient,